Healthcare organizations operate with the goal of addressing the healthcare needs of target populations. Multiple factors affect the policy and structure of each specific organization and can influence the development of these organizations and their goals. Ultimately, these factors inform the ways in which nurses will achieve the quadruple aim of healthcare: to improve patient experience of care, to improve population health, to reduce healthcare costs, and to improve the provider experience. The three major factors that influence healthcare organizations are economic factors, social factors, and demographic factors. Economic factors are a primary driving force in determining the configuration of healthcare organizations. Escalating healthcare spending at both the personal and national level necessitate an evolving healthcare system with organizational restructuring intended to reduce financial burdens. In 2015, the CMS reported that U.S. healthcare spending reached 17.8% of the gross domestic product, and that number continues to grow. Factors that contribute to this rise in healthcare costs and spending include the rising number of uninsured patients, the rapidly increasing cost of drugs, the expensive cost of new technology, and the increasing cost of hiring personnel. In order to ensure that healthcare is accessible to all citizens and to reduce the financial burden of healthcare organizations must adapt and be willing to radically restructure their systems to address these financial problems. Nurses play a key role in helping to control costs within organizations. The increasing emphasis on higher education for nurses allows for additional training in business management, which can promote critical skills in negotiating cost with quality service. Nursing leadership is essential in monitoring quality of care and in implementing quality improvement strategies. Nursing involvement in specific types of organizations, such as accountable care organizations, can result in maintaining care quality while negotiating with interdisciplinary teams to reduce economic burden on the healthcare system as a whole. In order to address the severity of the financial issues that plague the healthcare system, radical change and strong leadership will be important to guide the restructuring of organizations to improve economic outcomes and reduce the burden on both customers and the gross domestic product.
As healthcare workers, it's important for us to recognize that society is constantly changing and the minds of people are always evolving. So now more than ever, people are more focused on what they eat, what they do for exercise, and how their lifestyle is. So they feel more empowered to plan, organize, and have goals they want to have evaluated. As healthcare workers, it is our job to be able to help them evaluate these goals and plan programs and organizations around their goals and how they want to wish their life. Another important example that happened is the pandemic that recently came to America and all over the world. Now people are they're caring more about hygiene practices, about how to keep themselves safe and their family safe. As healthcare workers, it is important for us to implement strategies and programs and information about how to keep each other and our families safe.
Demographic factors that influence the design of healthcare organizations include geographic dispersion, regional access to care, incomes of population, aging of the population, and immigration trends. Some effects of these factors are that isolated areas make it difficult to access necessary healthcare services. It is also much more difficult to recruit healthcare personnel willing to work in those areas. Therefore, one solution is to establish community-based rural health networks. These networks would provide primary care links to urban health centers for teaching, consultation, personnel sharing, and the provision of high-tech services. Another solution for meeting needs in rural areas is to increase federal and state funding with incentives for healthcare personnel to work in rural areas. Nurses working in these areas must perform strategic planning in order to address the critical community needs. Also, it is estimated that by 2025, more than 18% of the population will be older than 65 years of age, and the number of people over 80 years old is also increasing. How does this affect healthcare organizations? This aging population increases the need for more long-term beds, supportive housing, and community programs. Although they may not increase independency needs, it is important for the nurses to continue to help evaluate, evolve, and restructure healthcare organizations to meet the other needs of the aging population.
Two theories are described as being supportive to healthcare organization evolution. First is the systems theory, which states organizations evolve in a pleasant manner, with unification of all parts leading to supreme productivity. The system, quote unquote, is composed of a structure, a set of technology, a set of people, and their surrounding environment. There is a focus on the input, which are the resources, including people, money, and materials, the throughput, which are the processes that produce a product, and the output, which is the products themselves. The theory goes on to state that the survival of a healthcare organization is dependent on its ability to adapt to changing environmental or external factors. The systems theory is classified as an open systems approach, as it depends on environmental factors for its success, whereas a closed system relies only on their own internal factors. The second theory, which supports organizational evolution, is called the chaos theory, stating change is unavoidable, accepting the universe as unpredictable and disorderly. The theory claims that organizations must accept inevitable changes and most successful managers use creativity and flexibility to adapt to these changes. Both theories are in opposition, one encouraging order and the other disorder. But when in proper balance, the two theories work synergistically to create a favorable, harmonized healthcare organization.
As healthcare organizations change, the leadership and management roles of nurses change as well. A focus on primary care and population medicine has led to an increase in the proportion of RNs in the community, care management positions, clinical nurse leaders, and advanced practice RNs. Nowadays, nurses need to become more involved in policy development, coordination of care across disciplines and settings, conflict management, and promotion of cost-effective care. Nurse managers and leaders need to facilitate both patient-centered and employee-centered care. This means that they need to understand how economic, social, and demographic changes affect the workplace and not just how they affect patients and communities. By focusing on this aspect, we can increase job satisfaction among nurses, which will lead to increased positive patient outcomes. In conclusion, today's healthcare organizations are constantly changing, and nurses need to be aware of and keep up with these changes. Nurses must assess internal and external forces of change to create and evaluate adaptations to these changes. By doing so, nurse leaders and managers can strengthen their healthcare organizations and nursing practice.